So let's go ahead and get started. Thank you all for joining us this afternoon. Hope folks are staying cool in the it's not even officially summer yet, but feels like we're already in the the hottest of the year. But glad folks to take a little time out of their afternoons to join us for this Doctors In program. For anyone who is new to Doctors In, this is a partnership that we've been doing for a couple of years now between the LGBT Elder Initiative at the William Wade Community Center and Jefferson Health, specifically the Jefferson Center for Urban Health and the Jefferson Department of Family and Community Medicine in the Division of Geriatrics. And so we do these now webinars for the past year, previously in-person programs, hopefully soon in the future back to in-person or some hybrid. But we do these with a different health topic every month, with Jefferson doctors coming in to share their knowledge and expertise about different health topics relevant to LGBTQ older adults. And today's topic, as you know, is memory and dementia. So looking at issues of cognitive health, obviously a very big topic, but we are very glad to have Dr. Emma DeLau here with us today. Dr. Emma is a resident in the Department of Family and Community Medicine, and in 2 weeks will be a geriatric fellow in the Department of Family and Community Medicine. So we are happy to have her here with us today, and hope that you will be back in your next year in your geriatric fellowship to join us for more of these. Just a couple of quick housekeeping things. I know many of you have been on these with us before. If you have questions throughout the program, feel free to input those in the chat, or you can input those in the Q&A feature. So you should be able to access both the chat and Q&A in the toolbar at the bottom of your screen. Just to note that anything you are putting in the chat does have your name attached to it. If you have something that might be more personal or sensitive, you can submit that through the Q&A. And with Q&A, there is an option where you can do that anonymously. For anyone on Facebook, type in your questions as a comment, and I will relay those to Dr. Emma throughout the presentation. All that being said, thank you again, Dr. Emma, for joining us. And I'm going to turn it over to you to kick us off for the presentation.
Great. Thank you for that introduction. I'm really excited to be here today and to talk to you all about memory and dementia. I personally think memory is super interesting, how it works and when it doesn't work. So I was excited to read up on it and share some information with you guys today. Before I start, I have to thank Dr. Collins, who's been here multiple times too, and has given multiple great presentations before, but she talked about dementia in 2018. And so I did use some of her slides. So if anyone saw that presentation back in 2018, there's going to be some overlap, but also some new information. So I hope it's still helpful. Dementia, then before we start, can also be kind of a heavy topic, and especially if anyone here is suffering from dementia or has a loved one suffering from dementia. And so I just want to put it out there that at any time, if anyone feels overwhelmed with all the information or doesn't want to listen anymore, please feel free to just log off, and no hard feelings at all. So we're gonna, if I can advance to my next slide, talk about quite a lot of things today. So I want to start just kind of defining what memory is and some common memory issues, especially as we get older. And then we'll talk about what is dementia, and specifically what is Alzheimer's disease. And we'll talk about the differences between dementia and Alzheimer's, and also the differences between Alzheimer's and normal aging. And then the majority of the talk will be discussing risk factors and warning signs. So how can you recognize that you or your loved one might be suffering from dementia? And what are reasons to talk to your doctor? And then what can you do to help keep your memory in good shape and try to help prevent memory loss? And then we'll end with some tips for caregivers, and I have some community resources that I can also share these slides later on so that people have it as a document too. So let's start with memory. So memory is defined as the power or process of reproducing or recalling what has been learned and retained which is a little convoluted, but basically you have to learn something and then store it in your memory to be able to use it. And there's different kinds of memory. And this is a little bit of a chart kind of showing what the different kinds of memory is. So there's short-term memory, which is really just the 20-30-second memory when you have to memorize someone's name or a phone number. And then if that memory is stored and you can remember it longer than 30 seconds, eventually it will become long-term memory. And there's different kinds of long-term memory. We don't need to go in too much detail, but at the bottom, there's episodic and semantic memory. Episodic meaning things that happened to you. So what you had for dinner last night, or where you went on vacation 2 years ago. And then the semantic memory is more so general knowledge. So who the president was in a certain year, or when a certain war was, or for example. So those are things that you've learned and stored in your memory. And then there's also more implicit type memory, which is procedural memory, meaning knowing how to do certain things. So how to perform certain tasks like brushing your teeth, things like that. And then priming is more of the memory based on previous experience that leads to certain behavior. So for example, people who smoke might crave a cigarette when they have a meal, for example, and that's kind of this implicit memory that's triggering. So there's different kinds of memory. And I wanted to show this picture, really not that we have to memorize all of the things that are shown here, but really to show how in the brain, there's a specific area that's very much used for memory forming and storing. That's that purple area there, it's above the ear, it's called the temporal lobe. And as this picture on the right shows, is there's different areas in the brain. Again, we don't need to memorize all these different names, but really there's different areas of the brain that that store the different kinds of memory. And why I'm showing this is to really kind of understand that if with any type of disease, but if there's an issue in a certain area of the brain that's for that particular memory, then you get issues with that type of memory. So for example, here on the right, I don't know if you can see my cursor, but here in this little small blob here called the cerebellum, it's really used for procedural memory, so how to do things. So if there's damage or injury to that part of the brain, then people will have trouble with procedural memory, so with how to do things. And we'll get back to this kind of how dementia fits in with this picture, but just to kind of show the different kinds of memory, different areas in the brain are responsible for that. And then with normal aging, it's normal that memory declines a little bit. So that's what you can see at the figure on the right, the top part, that blue line is the memory. And as you age, memory kind of goes down a little bit. And specific functions that go down with aging is learning new information and recalling new information. So it may take more time to learn new things, and it may take more time to do certain tasks that are newer, more recently learned. But there's also a lot of memory functions that remain the same, or that remain in good shape. So remote memory, things from long time ago, procedural memory, how to do the brushing your teeth or other tasks, and semantic recall. So the facts that you've learned before should all remain fine as you age. And then just showing on the right again, the difference between normal aging and a memory that goes down a little bit. Compared to Alzheimer's disease, what you can see is that that line really goes down steeply. So if someone is diagnosed with Alzheimer's disease, the memory will continue to go down and down and down and down all the way until, if severe enough, a person can not even function on their own anymore. These are just some other thinking abilities that with normal aging can change. So language, for example, if you've learned a different language, it might become harder to recall or use that language that you've learned before. It can be more difficult to remember certain names or words, and the speed of information processing goes down. It can be harder to multitask or to do new, more complicated tasks, and people's reaction time will go down. So, when you're driving and something happens and you have to brake, that time between seeing it happen and having to brake, that time becomes longer. And that's all normal aging. So moving on to dementia, what is dementia exactly? Dementia is a kind of a general umbrella term, not one specific disease, but it refers to memory that's declining or memory issues, but also other thinking abilities like language or problem solving. And really important for the diagnosis of dementia is that the symptoms are severe enough to interfere with everyday life. And then we'll talk about this in a little bit more detail, but it can be caused by many different diseases. So I'll show here on this slide, this is kind of the umbrella term. And here you can see there's different causes, different diseases that can cause dementia. All these different diseases that are listed here cause the symptom complex called dementia. And so Alzheimer's disease is the most common form of dementia. So a lot of time when we're talking about dementia, people actually mean Alzheimer's disease or think about Alzheimer's disease first, which makes a lot of sense because it's the most common kind. In 60 to 80% of the cases of dementia, it's Alzheimer's. But there's also other forms like you might have heard of Lewy body dementia or vascular dementia. Those are fairly common, 5 to 10%. And then there's some other kinds that also cause dementia. And then people can also have multiple different kinds. So that's called mixed dementia. And pretty common for the mixed dementia is actually for someone to have Alzheimer's dementia, as well as vascular dementia. Vascular dementia is can be caused by, for example, a stroke when there's not enough oxygen to the brain in those areas that are responsible for the memory. And so if someone has had a stroke, there could be memory loss or other issues, obviously. But the person could also develop dementia. And so then there's a mixed dementia. I hope that makes sense. That was a lot of information. The other part that's important to realize is that there's also things and diseases that can cause dementia that are treatable. So those Alzheimer's, we'll talk more about that, but is not curable. But there is quite a few things that can cause symptoms of dementia that would get better. The dementia could resolve all the way if those things are treated. So those are listed here. So very severe depression could cause symptoms that are similar to dementia. Some medications can have side effects that can cause dementia or worsen memory. Too much alcohol for too long periods of time, thyroid issues, and vitamin deficiencies. I'm showing this mostly to, make people aware that if they're worried that they might have dementia, that it's really important to talk, or a loved one, that it's really important to talk to a doctor, because there could be, a thyroid issue that if that's treated, then the symptoms of dementia will go away. Now talking about Alzheimer's disease. So Alzheimer's disease, like I said, is the most common form of dementia. And so that's also why there's the most information on this. The most research has been done. And symptoms of Alzheimer's disease really causes problem with memory. And that's usually one of the first things that people notice, memory issues, problems in thinking, and problems in behavior. And it's a progressive disease, meaning that it could start out, or it will start out with mild memory loss, and can get worse and worse over time, even so to a point where it's so severe that the person is not able to carry a conversation or doesn't recognize their loved ones, or basically can't take care of themselves. The exact cause of what causes Alzheimer's is unknown. There's definitely a lot of research being done, and there's some it's known that there's some abnormalities happening in the brain, but definitely not one straight reason why people develop Alzheimer's. And then there's no cure. So there's a lot of ways that we can support patients and support families, and a lot of things we can do to help with certain behaviors or if there's sleeping problems, but there's no magical pill or treatment that can stop or get rid of the Alzheimer's. And then people who are diagnosed with Alzheimer's, what I found online is that they say on average people would live 4 to 8 years, but there's also been people who live up to 20 years or maybe even longer. But this all, shows that it's a pretty significant disease, and it has a lot of impact on people's lives. And it's actually quite common. So about 5.8 million Americans are suffering from Alzheimer's, and it's very much a disease kind of that becomes more common as people age. It's in people over 65, 1 in 8 people has been diagnosed with Alzheimer's, and in people over 85, it's nearly half of the people. And so what this graph here on the right shows, on the one hand, that as age increases, that the number of people with Alzheimer's also increases, but also that it's predicted that on the line horizontally, it has the years. And so we're about here now. But it's predicted that as with time, there's going to be more older people. We'll also have a higher amount of people with Alzheimer's. I hope that makes sense, or at least is clear. So pretty common. I wanted to show this video really to highlight what's the difference between dementia and Alzheimer's, because it's kind of, they have overlap, and it's pretty challenging. So I'm gonna try to click this and then stop this screen. We'll see how technically challenged I am. So let me click this, and then
That was where you can keep it up, Emma.
Oh, really? Was it working?
Yeah.
Oh, great. Let me just move this a little bit. Okay. Let me know if there's any issues.
What's the difference between Alzheimer's disease and dementia? Perhaps you've been confused by these terms in the past, or mistakenly thought they were the same thing. Well, you wouldn't be alone, because knowing the difference between Alzheimer's disease and dementia can be tricky. But it's actually not too hard to understand. In a nutshell, it's like the difference between shortness of breath and asthma. Shortness of breath is not a specific disease. It can have many different causes, and asthma is just one of them. Likewise, dementia is not one specific disease. It's a combination of symptoms that has many different causes, including Alzheimer's disease. Still sound a bit confusing? Okay, think of it like this. You go to your doctor with shortness of breath. To find the cause, she listens to your chest to see if it's due to asthma or pneumonia. And then she checks your heart to see if your breathlessness is caused by heart failure or a very rapid heartbeat. She even asks if you've been worried in case your breathing difficulty is anxiety related. After her examinations, she concludes that your shortness of breath is actually a nut allergy. Similarly, when dealing with dementia, your doctor needs to figure out the underlying cause. And while Alzheimer's disease is the most common cause of dementia, it's not the only one. Dementia can also be caused by vascular changes in the brain, Parkinson's disease, Lewy body disease, vitamin deficiencies, thyroid gland problems, chronic brain infections, or medications. Even a very deep depression can sometimes look like dementia. Which means if someone you love has dementia, it doesn't necessarily mean that they have Alzheimer's disease. And that's very important for your doctor to establish. Because some causes of dementia, such as infection, medication reactions, an underactive thyroid gland, or vitamin deficiencies, can be reversible with the right treatment. So figuring out the cause and a plan of action could improve your quality of life. And that's why, if you or your loved one have the symptoms of dementia, you need to see your doctor to find out the underlying cause.
All right. I hope that clarified things a little bit. Okay. I'm just gonna keep moving, but David, interrupt me if there's any questions about anything in the chat.
Will do. And yes, just a reminder to folks to please feel free to put these questions in. I know there is one that just came up. Is what causes death in Alzheimer's?
Ooh, that is a great
Is
question.
that going to become fatal?
Yeah, that's a great question. And it's not something that I clearly outlined in the presentation in the rest of this, but we might be able to understand it a little bit more as we go farther along. But as Alzheimer becomes more severe and severe, and people are not able to, go to the bathroom themselves or talk, or sometimes people are not able to say that they're in pain. And so there's actually quite a lot of reasons why people could die from Alzheimer's, but including not eating anymore, not feeling hungry, and not having the ability to eat, or from infections. For example, if they're not able to say they have to go to the bathroom, or they're incontinent, and they're not able to complain about pain with urination, it might go unnoticeable that they might have a urinary tract infection. I would say those are the biggest things that come to mind right now. And maybe falling might be one too, falling and hitting your head. So there's basically, it can definitely lead to complications, and the brain disease itself could also lead to death. Maybe in the end, if Dr. Saltzman has, or maybe right now, if you have other answers.
No, you answered that perfectly, Emma. I think I think many people with dementia die from things that we all may commonly pass away, like still can have heart disease and things like that can cause death. But when death is really attributed to dementia, it's usually, just as you said, kind of the accumulated damage to the body over time that makes you predisposed most commonly to infections like pneumonia, or bloodstream infections, but also can be things like, as you said, kind of sometimes dehydration and malnutrition from the body not absorbing nutrients in the same way, and can also be infections due to pressure ulcers if we're not moving as much, and the things you mentioned, Emma.
Yeah, so great question. Complicated answer. So I'll move on, but yeah, feel free to interrupt again if needed. I wanted to talk a little bit about the risk factors for Alzheimer's. So there's things that we can change and things that we can't change. And of the things on the right that we can change, so age is really the biggest risk factor. It's not a cause of dementia or Alzheimer's, but it's clear that as age goes up, the risk of developing Alzheimer's also goes up. And that's kind of what this graph here on the bottom is showing. So after 80, the line kind of goes steeply up for how many cases, or the rate for people with Alzheimer's goes up. And then there's also genetics. So it can also run in the family, specifically having a father or mother or brother or sister, so close family. And especially if there's more than one person in the family who has Alzheimer's, you would be at higher risk. And then there's a whole lot of things that we can change. So lower education level, low physical activity, smoking, and then certain disease like depression, high blood pressure, diabetes, obesity, and poor sleep. And so we'll talk about these in a little bit more detail about what you can do. But these things are proven that they put people at higher risk of developing Alzheimer's. So what are the signs and symptoms of dementia? So obviously it can really vary per person, and also depends on how severe the disease is, how bad the symptoms are that people experience. But these are some common problems that patients with dementia can experience. So it's really problems with short-term memory. So not the long time ago from childhood things, but really the shorter term memory. Keeping track of a purse or a wallet or losing that, paying bills, planning and preparing meals, remembering appointments, and traveling out of the neighborhood, or issues when you're not in a familiar environment, basically, and getting lost. We're going to look at a little bit more brains here, really to show kind of as the disease progresses, how that goes together with how the brain is affected, basically, and what symptoms go with that. So in early disease, there's two areas kind of affected here that are circled. The area that's involved in learning and memory, and the area that's involved in thinking and planning. So that makes it harder to remember things, harder to learn new things, and harder to plan things ahead, or to do more difficult tasks. And then as it gets worse, there's this area a little bit more backwards, or back closer to the ear, that's involved in speaking and understanding speech. And so people can get trouble finding words, but more so actually trouble understanding language, or even speaking altogether. And also this area a little bit higher up, where it's the sense of where your body is in relation to objects around you. So this is when this is affected, it can cause people to get lost, or to not recognize where they are, or to not recognize familiar faces. And then even more severe, it's almost the whole brain that's affected, basically. And so people can lose their ability to communicate, to recognize family members, loved ones, and not take care of themselves, because there's so much brain affected here. So moving on to 10 warning signs of dementia. So symptoms that people could recognize, maybe that we see in dementia. And so I just wanted to go through these 10. So the number one is memory loss, that, again, important, disrupts daily life. So things that you could see is a person forgetting recently learned information, forgetting important dates or events, like birthdays, and asking the same information over and over is a big one. And then you could notice that a person with dementia might need to rely more so on family members or memory aids to do things that they usually were able to do fine before. This is different from age-related memory change, in that, as you age, sometimes people can forget names or appointments, but then remembering them later. So that would be normal for age, as age goes up. And so these signs are different from normal aging, basically. Number two is challenges in planning and solving problems. So a person with dementia could have trouble following complex instructions or working with numbers, for example, like paying bills or cooking a familiar recipe. And that's different from a normal age-related memory change, where people without dementia who are getting older can have occasional errors when they're doing their finances, but not something that really makes them unable to do them, if that makes sense. Number three is difficulty completing familiar tasks. So things like driving, using the phone, cooking, and that's different from a normal age-related memory change. That would be, for example, sometimes needing help using the remote, or if you have a new microwave, trying to figure out how that works. That would be more normal. So really the things you used to be able to do fine could become very difficult. Number four is confusion with time or place. So a person with Alzheimer's could lose track of what day it is, even what season it is, and also forget where they are or how they got there, and get lost, basically. And then normal for aging would be getting confused about what day of the week it is, but then later remembering. Sometimes you don't remember if it's Wednesday or Thursday, or I guess Tuesday today. But then later remembering, that's normal for aging. Number 5 is trouble understanding visual images and spatial relationships. So how different things are in contrast to each other, and determining color and distances between things. And this can make reading difficult, but also driving could be dangerous because of this. Normal for aging would be having vision problems because of cataracts, for example. Number 6 is new problems with words in speaking or writing. So a person with Alzheimer's could get trouble with following a conversation, or speaking, even trouble finding the right word, or even calling things by the wrong name. And normal aging would be not that severe, but having trouble maybe finding the right word during your conversation, and then after the conversation, remember, oh, that's the word I meant to say. Number 7 is misplacing things and losing the ability to retrace steps. So for normal aging, everyone loses things every now and then, but usually you're able to think back, oh, I went to the kitchen before I went here, so maybe I put it in the kitchen. But with dementia, people are putting things in unusual places and then are not able to remember or retrace those steps, and even might accuse other people from stealing. And I don't think I've mentioned this yet, but both my grandmas actually suffered from dementia, and one of them really had a strong thing in where she would always lose her purse within her house, but then would always accuse the neighbor of stealing her purse. So it was always every time we came over, it was the neighbor who had stolen her purse, and then 5 minutes later we would be able to find the purse for her, and then she would still believe that the neighbor had put it there. So it can be pretty challenging. Number 8 is decreased or poor judgment. So that could show when dealing with money or hygiene, or wearing inappropriate clothing for the weather. And that's different from normal aging, where you can make a bad decision once in a while, forget to change the oil in your car or something, and then remembering it later, and then still doing it. Number 9 is withdrawal from work or social activities. And I think, part of it might be the conversations that become more difficult, but it could also just be not being interested in hobbies or social activities or work. And so people with dementia tend to kind of withdraw themselves from those things. And another example is to have trouble keeping up with their favorite sports team, or even remembering how to do their hobby. And then the last one, number 10, is changes in mood and personality. So Alzheimer's comes with quite a variety of obviously changes, but also in how people are feeling. And so people can become confused, suspicious, depressed, anxious, or irritable, and also can have pretty big mood swings, which I think is one of the more difficult things for caregivers, that you could be with your loved one and out of nowhere they're very agitated. And the third point here is they could also kind of stop caring for themselves, or not wash their hair, use stained clothing. Normal for aging would be to not feel like going to that birthday party, or to not feel like being social, or becoming irritable when your normal routines are disrupted, but then getting out of that again too. This is a little bit of a summary, because I know that was a lot of information, but basically to show the difference between dementia and normal aging. So for dementia, it would be poor judgment and decision making, like what we talked about with the money and things. But for normal aging, memory issues would be making a bad decision every now and then. For dementia, there's inability to manage a budget. Versus normal aging, you could be missing a monthly payment, but otherwise do fine with your bills. Number 3, losing track of the date or season compared to normal aging, forgetting what day it is and then remembering later. And then difficulty having a conversation versus sometimes forgetting which word to use. And then the last one here is misplacing things and being unable to retrace the steps. But for normal aging, it would be just losing things from time to time, and then you're able to find them later or remember where you put it. I call this kind of the aha factor, that, you know, you can forget, this is normal, you can forget where you were going or that where you put something or that you had an appointment with someone. And then with a reminder, if you later see that person you had an appointment with, you're, oh yeah, we had an appointment, and then you remember it again. So that's normal aging. Important to not ignore the signs. So if anything we just talked about, if that sounds very familiar to you or a loved one, it is important to, even though it's really hard to face a potential diagnosis of dementia, it is important to think about it and to ask your doctor about it. Mostly because, like we talked about earlier, it could be that the symptoms you or your loved one are experiencing are not dementia, but maybe is a treatable condition, or it's a form of dementia that is treatable. And even if it's not a treatable thing like a medication side effect or depression, if it could be Alzheimer's, then it's important to kind of get the support you or your loved one need, because there is a lot of support and help that you could get. And if it is a treatable problem, or in any way, it's better to treat it earlier or to get the support earlier rather than later. And then what are reasons to talk to your doctor? So the first thing is if you or someone you know is experiencing memory difficulties or changes in how they're thinking. Specifically, if it's things that we just talked about, the more serious things that have bigger consequences for day-to-day life, like getting lost or leaving the stove on or not able to do their finances, things like that. Another reason to talk to your doctor is if you have questions or if you're just worried about your own memory or your loved one's memory, because it's always good to just kind of figure out where that's coming from, what exactly is going on, and to see where there can be help, and even to, you know, make sure that it's not something like maybe a thyroid problem that needs treatment. And then also important to go to your doctor if you're caring for someone with dementia and if you're having a hard time, or even if you're not having a hard time, just to hear, you know, more information or to learn about the resources that are out there. And then there's probably a whole lot of other reasons to talk to your doctor. Basically, anytime if you're worried or you have a question, is a really good reason to go to your doctor. Now that we talked about all the symptoms and what Alzheimer's and dementia can lead to, how can you reduce your risk? Because there is things that we can do to kind of make sure that our memory stays healthy as long as possible. So let's look at a few things. Number 1 is exercise. Exercise has actually really been shown in research that it helps your brain be healthy longer, and it helps with muscle strength, with coordination, also with mood and reduce anxiety. But really, research has shown that it slows down the rate of developing dementia. And so really, really important, obviously for overall health, but specifically for your brain too. And then this one is also, I'm sure everyone has heard this before, but having a good healthy diet is also really important for your brain. And specifically the foods pictured here. So fish, lot of nuts, and then green vegetables are all very good to keep your brain as healthy as possible. Another one that's really important is socializing, really because being social and talking to other people, listening to other people kind of keeps your brain active in the language and emotional department, basically. And so that stimulation is needed to really help keep your memory as good as it is right now. And then this one kind of goes together with that. So train your brain. There's a whole lot of memory books out there to keep your brain active, but puzzles, crossword puzzles are all very good ways to keep your brain active and to actually, you know, as you're using your brain, it stays active. So it's less likely or slower. It will be slower decline of the memory, basically. And then sleep. This is my favorite. So really important to sleep about 8 hours a night, or preferably at least 8 hours, really to give your body and your brain the rest it needs, because that's actually been shown to also lower the risk of developing dementia. Overall, here's another list with some other things that are important. Basically, just important to take care of yourself, important to take care of your brain, and important to take care of your body. So important to get regular checkups, to make sure, you know, that if there's anything that's wrong, that it's detected early. Important to take your medicine, especially blood pressure medicine, diabetes medicine, and to eat healthy foods and exercise we talked about, get enough sleep, and then limit alcohol intake, and if you can, stop smoking. And then stress is a big one too, which I'm realizing is really easy for me to say and hard to do, but if you can find ways to reduce your stress, that would be really, really good also for your brain. And so I just wanted to take a second to see if there's anyone who wants to put out in the chat, maybe if there's anything that about the things we just went through, things that they're either proud of that they're already doing really well, or things that maybe you're thinking, maybe I could work on this to really work my brain. So the exercise, healthy diet, sleeping, stress reduction. There was more brain socializing. I can take a second to think about that.
Yeah, so feel free, folks, to put into the chat. I was just interested, Dr. Emma, as you were talking through this, just in I feel like in almost every doctor's in session we do, we always mention healthy diet, exercise.
Mm-hmm.
You know what big preventative factors these are, not only for dementia, but for so many different health issues.
Yeah,
for sure.
To people, like I always say, we've kind of heard a lot about heart health and what a heart healthy diet is. And so I usually say that's very much like brain health, you know, that it's kind of healthy for your body overall. Mm-hmm.
Exactly. Yeah.
Did anyone have any feedback, either for things that you're doing currently or that you would like to do? All right, great, awesome. We got one to kick us off. So walking 2 miles a day.
Yeah. Wow.
So a great example of exercise.
Yeah, for sure.
Good job, Mark.
Yeah, just exercise is one of the most effective things for memory that we know of, much more than even the medications that are out there. So that's fantastic. And certainly the antioxidants in the dark greens formula sounds good too.
Yeah, that was the one that I had in mind. I need to eat a little bit more greens, but I have a salad next to me, so I'm working on it.
Nice.
We can keep going, but if things come up, just let me know. Some tips for maintaining independence. So one thing that's important is to use memory aids. So things like calendars, writing down your appointments, labeling things, using a pill box, maybe for medications, to remember to take the medications. That's all things that obviously anyone can do, but that will help keep someone with dementia or loved one with dementia independent as long as possible. Number 2 is to take safety measures. So having appliances that shut off automatically to prevent, forgetting to turn it off and it becoming a kind of a safety hazard. Lifelines, and to monitor the driving ability. Like I said, that it's normal when you drive as you age that the reaction time becomes longer or slower, basically. But if someone with dementia doesn't, gets lost easily, is not able to understand the signs on the road or even understand the car, then it's really important to, monitor for that, and on time think about alternate plans for transportation, like taking the bus or a cab, or transport by friends or something. And then number 3 is to get help and support. I think this is the most important one. So obviously friends, family, community, doctors and health professionals are there to help too, especially if you have questions or basically for anything. And then there's also services like meals that can be delivered or transportation. And then there's these 2 agencies I wanted to make sure, I'm sure most people have heard about these, but Alzheimer's Association is actually really great. I got a lot of information from that website, actually. Really great in explaining things to patients and caregivers about what is Alzheimer's, and also has a lot of resources about what you can do and things to get help. And PCA is also great. They have a lot of, we'll end with that too, but they're great for resources too. So wanting to end with focusing on the caregivers, because it's so important to not forget about, the caregivers who take care of patients with dementia. And I'm sure that there's at least one person here in the audience today who has a loved one with dementia or is taking care of someone with dementia. So really important to take a few minutes every day to do something that you enjoy doing, to take care, to take time for yourself, and to stay in touch with friends, and keep up with hobbies so that you have a way to kind of unload and de-stress and have a distraction too. And then support groups are really helpful too. And there's actually a lot for information and support. And through PCA, for example, they have, and Alzheimer's Association have support groups.
I just put in a little plug that the Center for Healthy Aging at Jefferson,
Yes.
we run a support group through the Alzheimer's Association. So say if you call or go online to the Alzheimer's Association to see the different support groups, we're the 19107 support group. So yeah,
that's awesome. 5 more tips. So try not to take behaviors personally, which I think is easier said than done, but people with dementia could be, become agitated or upset, or even push their caregiver away out of nowhere. And that's really the disease itself, and not because they, don't like you or you did something wrong. So try not to take it personally, remain patient and calm. And if there is behavior or something, or think about that pain could be a trigger. So some people, especially when Alzheimer's is more severe, are not able to say that they have pain, are not able to understand what's going on, or to tell you that something is wrong. So if there's a change in behavior, they're not sleeping, or get more confused than they were, it could be that they're in pain. So that's always something to think about. And then try to not argue or convince the person, because it's not really worth, it's difficult, but it's not worth your time and energy to try to convince the person with dementia, because they either won't understand or they're not going to remember. And it's more, and it might even trigger certain behaviors even more so. so basically it doesn't really lead to anything but more trouble. And then, yeah, this I kind of said, accept behaviors as a reality of the disease and try to work through it rather than having it affect you personally. And yeah, I'm gonna leave it with that. Lastly, here are some resources that I think will be helpful. So the top one is from the Alzheimer's Association. There's a 24/7 helpline that anyone could call with questions, and you talk to someone with a lot of experience with Alzheimer's. You know, if there's anything you're in crisis or your loved one is in crisis or you just have a question, doesn't matter. They can help figure out what to do. The PCA Caregiver Support Program I kind of mentioned already. And then there's adult day services, so that the person with dementia could go somewhere during the day and be watched, which would take off a little bit of the caregiving load. There's a really great book that I have to admit I haven't read myself, but it's called The 36-Hour Day, but it's basically kind of a guide for people suffering from dementia or for families, loved ones, where it's all kind of explained. And then I found this last resource. It's called IDEA, or Aging with Pride. And it's a new program that was developed at the University of Washington. And it's a coaching program for people with memory loss that are above 50 and for their caregiver. And they have as a requirement, I think the person with the memory loss needs to be above 50, and at least one of the two participants, so the person with the memory loss or their care partner, needs to be LGBTQ. And then it's virtual sessions for 6 weeks, really focusing on physical functioning, health, well-being, and it's pretty new. It's still being researched. And so as of the latest information I saw online, if you were to want to participate in it, I believe you might still actually get money because they are interested in your interview and would use it for research.
I'm glad you included that one, Emma, because I just learned about that recently. Aging with Pride is well established. They do a lot of great work out in the Pacific Northwest. But yes, the idea, the dementia programming is new and all virtual. So it's a great way for people in any part of the country to be able to have this very personalized coaching and caregiving support tailored to
It seemed really cool to me, and I included the link because they have a video that explains everything in more detail, obviously, than what I just did. But yeah, it seemed pretty cool. So ageidea.org is the website to see the video. And then this is, I guess, my last slide. So just to summarize, because I know that was a lot of information. Dementia is a general term for decline in memory and other mental abilities, like we talked about, so language or social functioning behaviors that interferes with daily functioning. So that's the key, besides the memory issue, the key part of it. And Alzheimer's disease is the most common cause of dementia. There's no identified specific cause of Alzheimer's disease, and there's no cure. There's a lot of ways that people can be supported. There's even medicines to help out, but really no medicines that can take away the disease. And then there's risk factors that are changeable that you can work on to reduce the risk of developing Alzheimer's disease. And so I just want to end with questions.
Thank you
thanks
so much,
everyone, for listening. Yeah.
There was a couple of questions and comments that I just wanted to relay. So one, and this was from our Facebook page when you were asking the participatory part of what people are doing. Someone commented water aerobics as their way for exercise.
Yes.
And then also suggesting senior centers or community centers as some of that social engagement.
Yeah.
So sorry, I missed those live to our Facebook viewers. And then
thanks for offering those options.
There was a question that actually Dr. Salzman had answered in the Q&A, but the question was about Prevagen and some of these other supplements that are put out there as memory supplements. So the question being, do those actually help? And Dr. Salzman had added that. Unfortunately, there's not good data showing that, in this case, Prevagen, there's not good data showing its clinical effectiveness, but would offer up to you, Dr. Emma, if there's anything else that you would add on Prevagen or any of these other memory supplements.
Yeah, honestly, not really. I've personally, I don't have any experience with that supplement, so I, would have to look into it. But I believe that with a lot of these supplements, the issue is that there's just not enough research. A lot of times with supplements, there's different doses of things, and so it's hard to really do large research studies that clearly show evidence. But I think, if someone wants to take supplements or are taking supplements, it's good to talk with your doctor about which kinds, just to make sure that they don't interact with any of your other medicine. But a lot of them are, safe and good for overall health. But I don't have any evidence-based answers, unfortunately.
But a good point there that anytime you're thinking of starting a new supplement, talk that over with your healthcare providers.
Yeah.
Yeah, another common supplement is Ginkgo that some people will use for memory. Also doesn't have great evidence, and that one can actually interact with some medicines and some medical conditions. So definitely a good one to talk to your doctor about if that's something you were thinking of taking.
The other question that came in was just, would these slides be available? And yes, assuming that's okay with you, Emma.
Yep.
So if you got, for folks who are on the Zoom, if you got an email from me yesterday with a reminder and a link, it means I have your email, and I will send these out to you. If anyone is joining because you got the link straight from our website or joined from Facebook, just send me an email. I'll put my email in the chat here, and I'll make sure to get you on the list to share these slides out. There, just put my email in the chat.
Great. Yeah, I hope it was helpful.
We're right at 2:00, and in respect of everyone's time, we can wrap this up if there are no other questions. But thank you so much to you, Emma, and Dr. Salzman, for joining us here this afternoon to share all this great information on a big topic. But this was a great overview. And some great resources of where folks can go to find out more. And thank you again to all of you who joined us over Zoom or over Facebook.